Hello, brothers and sisters. I want again to welcome all of you to this lesson. Remember, we are still discussing about different types of disability, of course, in relation to hearing impairment. In the last lesson, we talked about intellectual disability, where I did mention that is the significant limitation in terms of skills needed to live and work in the community. In this lesson, I want us to focus on people with acquired brain injury. And we say that this one refers to any type of brain damage that may occur after birth. So any damage to the brain after birth, we refer to it as acquired brain injury. So the injury may occur because of infection, because of diseases, lack of oxygen, or trauma to the head. So any of those four that I've mentioned may bring about acquired brain injury. So the long-term effects are different for each person and can range from mild to profound, just as we mentioned during the lesson of hearing impairment. Now, it is common for many people with acquired brain injury to experience the following, but not limited to: one, increased fatigue or mental and physical disorders, some slowing down in the speed with which they process information and plan and solve problems. So because of the damage to the brain, when it comes to processing information, planning and solving problems, these people will have a challenge in managing some of these skills. The next one is changes to the behavior and personality, physical and sensory abilities, or even thinking and learning may also be difficult to them. Lastly, may also have difficulty in areas such as, of course, memory, concentration, and communication. So anyone having acquired brain damage or injury may have or experience some of these things we are talking about. So a person with acquired brain injury does not have an intellectual disability and does not have a mental illness. We should not confuse between the three disorders. So I did mention that mental retardation should not be confused with madness. Neither a person experiencing mental retardation should not be confused with intellectual disability. And anyone experiencing brain damage or acquired brain injury should not be mistaken that that person have a mental retardation or intellectual disability. Acquired brain injury is a disorder on its own and affects the person the way we have discussed. See you in the next lesson.